Are you struggling with painful periods, pelvic pain, or abnormal bleeding? Have you faced dismissive doctors, ineffective treatments, or recurring symptoms after surgery? Well, if so, you're not alone. Today, I'm joined by Dr. Brooke Winter, a fellowship-trained, board-certified gynecologic surgeon and founder of Full Spectrum, a clinic that's dedicated to supporting women who face these challenges. Dr. Winter's mission stems from hearing these heartbreaking stories time and time again from her patients, stories that now drive her passion for better care. Full Spectrum offers a holistic approach to treatment, including endometriosis excision, fibroids surgery, pelvic floor therapy, acupuncture, nutrition, and mental health support. Dr. Winter is here to educate, empower, and guide you towards the treatment options that are right for you. Dr. Winter, thank you for joining me today.
Thank you for having me, and thank you for that kind introduction.
So, of course, I've had several friends, several family members who have gone through some of the problems that, or I guess you could say, medical issues that you treat. But what I'd like to know or share with some of the women is, what are some of the symptoms that lead women to seek your care?
That's a great question. So two of the most common diagnoses that we treat are fibroids and endometriosis. The full name is Full Spectrum Fibroid and Endometriosis, which I know is a mouthful. So fibroids are benign growths in the muscular wall of the uterus, and when they are near the lining of the uterus where the periods come from, those are the type that are more likely to cause really heavy or irregular menstrual bleeding, and they can also cause trouble getting pregnant. And then when fibroids are more on the outside of the uterus and they get bigger, they can press on things that are nearby and cause pelvic pain and pressure. So if they're in the front, they can press on the bladder, make it feel like you have to pee all the time. If they're in the back, they can press on the rectum and cause trouble with constipation. They can make the uterus quite enlarged, so it kind of feels heavy, like a weight or a bowling ball sitting down in the pelvis. We call those the bulk symptoms of fibroids. They're symptoms women have from the fibroid just being in there taking up space. And sometimes that's more than pressure. Fibroids can also cause pain, abdominal distensions. Women can look like they're pregnant when they're not, which can be heartbreaking if they're trying to get pregnant. So those are kind of the most common symptoms of fibroids. And, heavy bleeding can be very significant. I have patients who, I just had a patient I had to send in the emergency room to get a blood transfusion. So people can lose a lot of blood. That can be life-threatening. Sometimes it's more just of an inconvenience, but sometimes it actually is enough that it turns into a serious health risk. Sometimes fibroids will get big enough that they'll obstruct the flow of urine from the kidneys down into the bladder. So the urine backs up into the kidneys, and that can cause silent kidney death over time. So people think of fibroids as just benign, we'll just watch them, but they actually can cause very serious health problems. So I just encourage women, if they're not being heard by their primary care doctor or their regular OBGYN, to really seek out a specialist for those issues. Mm. And then endometriosis is different. Endometriosis is, but a lot of women do have both. Endometriosis is when cells that are similar to the cells in the lining of the uterus are growing outside the uterus. And we don't know how they get there. There's a lot of different theories, but my favorite theory is that maybe women are just born with the cells in the wrong place. And the problem is that every month when the lining of the uterus sloughs off and women bleed out the vagina and have a period, the endometriosis cells bleed too, but they're in the wrong space to come out the vagina. They're trapped in the belly. Blood in the belly can cause pain and inflammation, and over time it can cause fibrosis, which is like a thickening or a hardening of the tissue. And then it can also cause adhesions, which means things are kind of stuck together and kind of pulled and tugged in an unnatural way. So the most common symptoms of endometriosis would be painful periods, painful intercourse, typically worse with deeper penetration, painful bowel movements, pelvic pain outside of the period. And then sometimes people have a lot of GI symptoms like bloating, alternating constipation, diarrhea. So those are the most common. People can also have back pain, hip pain, leg pain. So those are the most common symptoms of endometriosis. And then sometimes women don't know what's causing their symptoms, right? I mean, just heavy bleeding at baseline can be a reason that women can come in. So you don't have to know what your diagnosis is before you make an appointment. But yeah, if you're if you're soaking through, a pad every hour or two or a tampon, large clots, accidents bleeding onto clothes and bed sheets, having to wake up at night to change, that amount of bleeding is not normal. Over time, that can lead to anemia. And so we encourage women to come in. I see a lot of women who either just thought that heavy bleeding was normal and that really painful periods and missing school, missing work for their periods was normal. It is not. Most people have some cramps, but most people can pop an ibuprofen and they're fine, and it doesn't affect their daily life. So if these things are affecting your daily life, that is not normal. And we should try to get to the bottom of the diagnosis and then, present you with a wide range of treatment options sort of based on what we think the cause of those symptoms are. And then sometimes people have been going to doctors. They know it's not normal. They've been going to doctors, and the doctors just aren't hearing them. And that's the case where I encourage women to seek out specialists. And don't take no for an answer. If you think something is wrong with your body, you're probably right.
So why do you think so many women with pelvic pain are dismissed by the doctors, and how do you handle that differently in your practice? I guess, and when do they know, like you said, when to go beyond their regular family practitioner?
Yeah, I just think there's a lot of misconception in the community and among doctors that periods are supposed to be painful. And I honestly think that's just sort of rooted in our patriarchal society and misogyny. And we know that women's symptoms are ignored. Women are more likely to be sent home from an emergency room when they're having a heart attack than men. They're less likely to get pain medication than men. They're more likely to, have long years before they get a diagnosis for, lots of different things, not just gynecologic symptoms. So we know that this is sort of a cultural systemic problem. The other thing that happens, even if women get to an OBGYN and they're having pain and the OBGYN suspects endometriosis, is that most OBGYNs didn't get a lot of training on endometriosis in their training, and they didn't get a lot of training on endometriosis surgery. And so they might think, yeah, you might have endometriosis, but, there's nothing we'd really do about it besides give you birth control pills, which is not true. But women hear that a lot. But, the only way to know for sure if someone has endometriosis is to do a laparoscopic surgery. And then when you get in there, you want to have a doctor that's prepared to be able to remove the endometriosis from all of its locations, even if they're sort of tricky, sensitive locations. And you want to have a surgeon who is trained to detect the really subtle, types of endometriosis, which would be missed by most general OBGYNs. So I think the reason women get dismissed is a combination of lack of knowledge and then just having a doctor who's not comfortable with the treatment, which is fine. But then the next step should be referral, not leaving the patients just with no plan or having to, search for hours on Google to find a specialist. Like, we should get primary care doctors and OBGYNs to refer in these situations where someone's in pain and they don't know what the answer is, or they don't feel equipped to deal with the problem that they think they have. And
so maybe this is a dumb question, but I thought a gynecologist was already considered a specialist. No?
Well, there's sort of degrees of specialty. So a family practice doctor or an internal medicine doctor, those are typically the primary care doctors. And then an OBGYN does specialize in women's health. But the field of OBGYN is very broad. So it is the only surgical subspecialty that's the training is only 4 years instead of 5 or more. So like orthopedic surgery, general surgery, ENT, that's all 5 years of surgical training. And they just do surgery. I mean, that's what those specialties do. In OBGYN, which is only 4 years of training, we have to teach the residents how to take care of pregnant women, how to deliver babies, how to do a lot of primary care in the office, because a lot of OBGYNs are also the functioning as the primary care doctor for their patient, and then how to do surgery. And when we look at the residency training breakdown, it's about 50% obstetrics, 25% primary care, and 25% surgery. And that's 25% of 4 is 1 year of surgical training spread out over 4 years. And surgery is getting very, very complicated these days. And so there's a lot of discussions nationally about, is that enough surgical training? And the fellowships, which are the additional training after your regular OBGYN training, are where people gain additional skill sets. So minimally invasive gynecologic surgery is the fellowship that I did. So that was 2 years of extra surgical training after the regular OBGYN training. And then ever since I've been in practice, I've never delivered babies. I don't do routine care. All I do is surgery, mostly laparoscopic surgery for fibroids, endometriosis, and other things that are not cancer, and some hysteroscopic surgery as well. So, yes, OBGYNs are specialists, but then there are subspecialists. The other sort of categories of subspecialty are gynecologic oncology for women with female cancers, maternal fetal medicine, which is like a high-risk OB doctor, REI, which is reproductive endocrinology and infertility, which is the doctors who treat infertility and do IVF. There's urogynecology, which is the doctors who treat prolapse, which is like the bladder or the uterus kind of dropping down, and incontinence, which is leaking urine or sometimes stool. So those are the subs, and then minimally invasive gynecologic surgery, which is what I do. So those are the sort of the subspecialties. So yeah, it can be tricky for women to know. And, there's general OBGYNs who do a lot of surgery and are good surgeons. And then there's general OBGYNs who have really stopped doing surgery because they just felt like, hey, I was only doing like 3 hysterectomies a year. That's probably not enough to maintain my skills. And so a lot of them have given it up. But there's just such a broad spectrum that it's a complicated system for patients to navigate. That's for sure.
Yeah. So you offer treatments like pelvic floor therapy and with acupuncture alongside that. How do these work together when you're helping your patients heal and feel better?
Yeah. So we know that endometriosis and fibroid patients can have a lot of bloating and bowel symptoms, and that can certainly be from endometriosis or fibroids, but there's a lot of dietary things that can cause bloating as well. And so working with a dietitian that's knowledgeable about women's health and these gynecologic conditions to kind of optimize everything else can be very helpful. Dietitians can also be helpful for kind of getting patients prepared for surgery and, what things are kind of good to eat afterwards, how to avoid getting constipated afterwards. So that kind of fits with the both sort of holistic long-term and the sort of pre and post-operative surgical plan. Pelvic floor physical therapy is interesting, and I think a lot more people are sort of learning about it now because I've seen it a lot on social media. So the pelvic floor is like a bowl of muscles that hold everything up. And there's only 3 things that pass through the pelvic floor. There's the urethra, where you pee from, the vagina, and the rectum. And in some women, those muscles become really tight and spasmed, and that's another common cause of pelvic pain. A lot of times what's happening is women have endo or fibroids and they hurt. And what does your body do in reaction to pain? It tenses up. So sometimes if I go in there surgically and I fix what's wrong, the pain gets better, the muscles relax, everybody's happy. But sometimes even though I go in there and fix what's wrong, those muscles are just so trapped in a pattern of spasm, and they've been spasm for so long that they don't let go. So if people continue to have pain after surgery, which I hope that they don't, but if they do, the next step would be to treat the spasm in those muscles. And that's done with pelvic floor physical therapy. It's intravaginal work. The physical therapists teach women how to identify when those muscles are tensed and teach them how to relax. And so that can be really helpful afterwards. And then for some people, they don't have an underlying diagnosis like fibroids or endometriosis, and tension of the pelvic floor muscles is just sort of the primary source of the pain. That's more common in women who have any history of sexual trauma or abuse. It's more common in women who have depression and anxiety. And there's also a correlation with people who have TMJ or grind their teeth. Tension in these muscles seems to correlate to tension in these muscles. And so, sometimes pelvic floor physical therapy is not like the secondary treatment, but the primary treatment. And then pelvic floor physical therapists can also be really helpful, kind of getting people ready for surgery and recovering after surgery, and recovering after childbirth. That's another big area where they can help women. So that's how pelvic floor physical therapy plays into what we do. Acupuncture is something that I've learned more recently about. I was actually talking to a girlfriend who's an infertility doctor herself. She was going through IVF herself, and she was using an acupuncturist, and they actually employed an acupuncturist in their fertility clinic. And she was like, oh, this is something we recommend to all of our fertility patients. And I had no idea. I thought, I didn't really know if there was good evidence that acupuncture is effective. And it turns out that there is. I mean, it's been used in Eastern medicine for a long, long time. And I think in Western medicine, we're just starting to come more into the mainstream. It's usually covered by insurance, which is awesome. And so acupuncture can help with pain. It can help with relaxation. It can help as an adjunct treatment to fertility treatments. It can help a lot with GI symptoms and bloating. And a ton of other stuff that I am still learning. But that's kind of like, I've just dipped my toe into sort of learning about acupuncture. And I love it when our acupuncturist is here on Thursdays. I'm just like, learning a lot from her, which is fun. And she's, learning a lot of gynecology from me. So our dietitian, our acupuncturist, our pelvic physical therapist, and our mental health specialist, they're not employed by me. They all have their own businesses, but then they come and see patients in the clinic 1 day a week. So that's kind of a neat model. And they also, like the dietitian, for example, and the mental health practitioner will also see patients virtually, which is nice because some, patients don't like having to drive. And they all take insurance, which is great. So yeah, we're really excited about this team concept. And this is brand new. Like, I don't know anyone else who has done this to this extent, and especially bring all the people together in the physically same location, because there's a lot of synergy that happens just sitting in the desk next to somebody, right? Like, I've always had a pelvic floor physical therapist who I like and I refer to, but if you're not like physically in the same space, it's just not the same. You're just not really a team. So I'm really excited, but this is like, all brand new. Like, the mental health therapist hasn't started seeing patients here yet. I think she's going to start next month. The acupuncturist has only been here for a few days. The dietitian just had a baby, so she hasn't started seeing patients here yet. But like, this is brand new. So like, we don't really know how it's all going to work together, but I can already tell that it's going to be awesome.
I tell you, I brighten up when I hear any medical person incorporating acupuncture, because I used it years ago. Mine was mainly to kind of prolong being able to get pregnant, although that fiance wound up not being someone for me to bother going that direction. But what it did was the acupuncture made my change through menopause effortless. So I tell women constantly who are going through, I guess you could say, a rough menopause, get acupuncture, because I swear by it. So constipation, everything.
Yeah, I was going to say, if you don't mind me asking, if it's not too personal, like hot flashes, night sweats, is that what it was helpful for?
Yes, well, I had minor hot flashes during the day. I know it could have been worse because I know what my mother went through, but I would just get a little bit warm while I had a social media business at the time and was in the entertainment industry. So most of the time I was on my sofa working. So I would just turn on the fan briefly, and that was it. It was nothing. I would have some hot flashes here and there, but it was nowhere near what I'd had before that. Yeah.
Great to know. Good to know.
Any other symptoms I hear friends complain about? I'm clueless about it because I'm like, I didn't go through that. And I credit acupuncture because of that.
Awesome.
Yeah.
Good to know. I love that.
So, of course, you're in the Washington area.
Yeah.
Can you share how a potential patient can reach you? And if you work with patients from out of state, and those who can't get to you, maybe it's affordability issues, how could they find someone similar to what you do?
Yeah. So we're located in Seattle, Washington. We're in the Ballard neighborhood, and you can go to our website, fullspectrumgyn.com, or if you just Google my name, Brooke Winter, it pops up and the link to my website is there. And you can schedule an appointment online, or you can call. The phone number's on the website and on Google. And I do work with out-of-state patients. I have patients send their records. I have sort of like my office manager knows what records exactly I need, and then they send what surgery they want. And I kind of review everything and make sure it's feasible, make sure there's nothing else they need. And then we try to coordinate their trips so they can come in and have their consult and their surgery within the same week. And then I usually recommend people stay in town for, probably a week afterwards, just to make sure everything's fine before they go home. So yes, we do have a program set up to try to make it more convenient for out of town or out of state patients. And we have a lot of patients traveling from other states and even other countries. If patients are not able to travel, it really depends on what surgery you're having And if you already have a relationship with a general OBGYN, if you have an OBGYN who you love, it is definitely worth talking to them, seeing, what they think, what their opinion is. If you need a surgery, are they comfortable doing it? And then, you always want to ask questions like, well, how many of these do you do? And what are your most common complications? And that type of thing. And then if, some general OBGYNs will refer to somebody like me who just does surgery, or patients can ask for a referral. So that's one way to go. And then if you don't already have a relationship with a general OBGYN and you think you're going to need a surgery, you can often just go straight to a minimally invasive GYN surgical specialist like myself. So, what you want to look for in the training is the OBGYN residency, followed by 2 or 3 extra years of surgical training. That's called a fellowship. And then you want to see someone who has a practice where they're just doing surgery. If that's what you're looking for, is a super subspecialist. So you can tell that from their usually from their profiles online, or by calling and talking to their receptionist. And then patient reviews can be really helpful. I mean, a lot of patients will leave really detailed personal testimonials, and everybody can have an off review here or there. So you have to take them a little bit with a grain of salt. But when somebody has tons of positive patient testimonials, that's always a good sign. So those are the things that I would look for.
Okay, perfect. Thank you so much for joining us. This was very informative. Ladies, you can't skimp on your health at all, especially when it comes to I guess you could say, what is our inner workings? Make sure you take care of yourself. Thank you, Dr. Winter, for joining us.
Thank you so much for having me.